One of the biggest things that I see being a problem nowadays in the world of chiropractic is that not all issues are coming from just the spine themselves. And so the answer to this and why it is so important that we address extremities or arms, hands, legs, feet, these outside areas from the spine is that they can have issues within them that don't just come from the spine itself as the original problem. It can actually be a problem in those other areas, and we have to recognize and address those issues themselves. So for those of you who don't know who I am, I'm Dr. John Clayton. My office is Supra Chiropractic. I am a specialist chiropractor in Utah, and the things that I focus on are different from other chiropractors. We like to address issues that are outside of the spine, and that's where a lot of these issues that I end up treating, such as sciatica. I work on a lot of paralysis in the face area, jaw problems, rib cage problems. I address plantar fasciitis and so many more things. So with this, that is not the approach that most chiropractors take, and it's kind of sad. But in the end, we're going to show you as we go through this video how I adjust, how I go through, and we fix these issues. And one of the ways that we will do that as well in this video is dry needling. And so with dry needling, we go in with acupuncture needles and we go into these areas that are where the problem is, but also we address what is the primary issue here. And one of the things for this patient that we helped him address is that he has a knee complaint. And it's not necessarily a knee problem, but it's in the area of the knee, therefore it appears to be a knee complaint. And so the more we understand the anatomy, yes, it's in the knee area, but it is not necessarily a knee problem. It's a muscular issue that connects from the knee down to the ankle, and because there's a nerve that runs through there as well, it causes other issues. And because of a muscular group in the upper leg that it's tight and strong or hyper-developed, it then pulls and creates other issues that then cascade down the chain. And so a lot of times when I go through and work through these issues is we have to actually look at what's the primary issue, secondary issue, and tertiary issue, or fourth, fifth, sixth problem, whatever, right down the line. And if we don't address them, for one, in the proper order, we don't see results. And so that's what we're going to go through in this video, where we actually address and we describe the anatomy as I'm going through in dry needling as to what we're doing. And we're just kind of here for the ride. And so I hope you guys enjoy this video. Sorry it was a little bit longer of an explanation in the beginning, but I hope you guys enjoy the adjusting, and then that means that I don't have to explain as much at the end for you as well, unless for those of you who want to know kind of the deeper anatomy as to why we did what we did. So enjoy the video, and we'll catch you at the end for a recap. Okay. Any last words? Mm-mm. Okay. See how many back pops are left. Mm-hmm. You got here for me? All the way. Gracious, you're right. Oh, roller table couldn't get that one, huh? Breathe in here, breathe out. Yeah. Breathe in here, breathe out. Breathe in here. Gracious. So you know you're tight when you got to double tap every single rib right there, so. Okay. Ready for your favorite one? Mm-hmm. Okay. Well, I think your back is tighter after Disneyland. So, that's okay. That's okay. Breathe in here. Breathe out. Breathe in here. Breathe out. Breathe in here. Here. Wow. We're going to cheat a little bit here. Luckily, we're not going to make you take off all your layers here, but we're just going to kind of clean up. If I can get this to not slide on your material there. Break up this a little bit here.
I'll take off my hoodie.
Oh, it's all good. It'd hurt too much if you did that. I think a lot of girls will get jealous if you take off your hoodie, you know. So, like, who is that guy? Like, who can't tell you? Patient confidentiality. He's married though, so calm down. The only hard part is when you go over the clothing with this, is I can't see how marked up your back is, so I just have to go off of your pain tolerance. So, but I do it over the clothes quite a bit on people nowadays because then you're not having to get all the oils and stuff on them and everything. And if you have back knee, you don't get my tools all gross, you know, so it's even better. How's the back doing down here?
It's good.
Good now? Okay. Just switch one problem for another one, right? Okay. Just gonna run through these real quick here. Just to kind of do your QLs. There we go. If it's too intense, just let me know. Here. Give you the double whammy here. Glute max. Dig it in there. Kind of pull up on the lat at the same time. Just say my prayers right now, right? I definitely need this too right now, I can tell you that. And dude, I don't know why your lat is so freaking tight.
It always is.
Well, I train back every day, so that's probably why. Every day, back day.
Did do back yesterday.
That's got to be why. 100%. I did back last year, so I'm good. It's like the swan dive position here. And then as we go through the knee on you as well, kind of the biggest thing too is where that sciatic nerve comes down here, okay, it's going to kind of shoot off and around and then wrap and become the tibial nerve right there, right? Mm-hmm. So I always wonder too if there is some issue at either outside hamstring, right? Because you feel right through there. So you're like, that's pretty soft right there where that tendon is. Mm-hmm. That's like a knot right there. Mm-hmm. Okay, so let's break that down and see if it helps kind of relieve lower when you get in there, okay? Mm-hmm. It's going to suck a little bit, okay? So we're going to bend it up a little bit here. Get right in that kind of musculotendinous junction. And then pull up. Yep, and then bring it down.
Oh, that's a little bit
too much? Okay. That's pulling hard though. That's an insane one. You see how much tighter that one is? Mm-hmm. Okay. No problem. So if that tendon stretches too much, then I'll go to hyperextension and just pressure. If this one's too much too, just let me know. Okay, and right up here, this one's going to suck a little bit. We've got popliteus, which is going to be right back here, kind of goes diagonal here. Helps with changing your foot position, like that, rotating like that. Okay, so we're going to go here. Stretch. And the hard part too is as a golfer, right? You're swinging, right, and this foot having to take the brunt of that knee twisting, right? Mm-hmm. Whereas this one actually gets to turn and move with your swing, right? Mm-hmm. This one's having to take that brunt of keeping that toe pointed straight, right? And that's why this popliteus is going to be freaking out on you, right? Mm-hmm. Last one here. It's going to be right in that angle right there. Now you can see where people opt for the needles rather than that stuff. So, but Feel the difference though now. See how soft that is compared to this side here? Right. Can actually feel blood flow in there, right? Look at that.
Doesn't feel great.
You're like, not worth it. Don't do it again. Not worth it. So, I know it's that hard borderline of like deep tissue being helpful versus just pure pain. So, I got you. Okay, so now I'm gonna have you lay on your right side there for me. So first thing you do before you do your lower back, I'm gonna set that fibula. So we'll give us the famous bikini pose. Sorry, it's bright in here. We went to different bikini posing schools, I think. Just kidding. Wait a second, how am I supposed to do this?
I don't know how I'm supposed to do it.
You don't know the bikini pose?
No.
Come on.
I thought it was that one.
Wrong magazine. So. You don't subscribe to Chiropractor's Economics? Okay. Me neither, so.
Chiropractic Illustrated.
Yeah, guys, seriously. Hey, you're the front cover page now, look at that. Ugh. Could you imagine?
The most boring magazine ever.
The worst thing ever. Let that relax there. This is the one part people are like, it popped, finally, you can hear pops. I guess this is the table thing. Just my little table thing, sorry. Little speeder table thing. Dang it. Quick here. You're just dying for me to hit that quad again, aren't you? No chance. We'll needle it today. So I won't put you through that. So way too brutal. Okay, so we're gonna bend this guy here. Tuck that guy back there. Scoot you toward me here. Slide that down. Big hug. My gracious. It popped after. I hit it and it popped after. All right.
The recoil.
So, yeah, recoil effect there. Relax there. Hold that there. Deep breath in here. All the way up. My gracious. I thought roller coasters were supposed to loosen you up. Not the opposite. Holy cow. All right. Let's do it. Okay. Let's fix that rotation real quick. Let's do it. Let that go there. Let it go. Okay. We're just going to swing it around. Bring it around town. Around town. Around town. Come on, knee. Let go around town. You gotta start working out. You're stronger than me. Can't move it. Let that go. Okay, let it go now. Okay, slide up for me there. Let that go. Super glued in there. Check them arms. Go there. Easy. Easy elbow. You ever been told you're easy on the elbows? It's like easy on the eyes, but easy on the elbows, huh?
Yeah. Because I'm not easy on the eyes.
Yeah. I'm not either, so don't worry about it. I definitely will not be on the cover of Chiropractic and Illustrated. So.
Yeah.
Yeah, it's fine. There they are. Save them all in your neck there. Huh? Get it here. It's like popping already. What the heck? Recoil on the neck too? Same thing, huh? Breathe in. Breathe out. Let go. Easy peasy. We're going to do our famous spell here on the leg because we have some way bigger and more defined leg muscles than what I have. And so we have our famous wand here, our pointer that we like to use in these videos. And so we're going to do our spell here. So we're going to do our famous spell of rectus femoris. And that's what a leg muscle should look like. Don't look at my legs. Perfect. And let that relax. So the reason why we're showing this in this video is because when the quads pull too much, the insertion of where these quad muscles go into is going to become the patellar tendon, which then hooks on here. So if you're a fan of anatomy and you like to understand the anatomy and the whole bone location structures and all that, is we're going to have the tibial tuberosity right here, which is going to be where the patellar tendon hooks into. And so as the quad overdevelops, a lot of times it's going to be for powerlifters, bodybuilders. It's such a cool muscle to have that so many people would like to have it. That's why we were able to showcase it here, is that when it overdevelops in comparison to the hamstrings, is that you're actually going to see that where it connects into, it'll pull that tibia more forward and shear it forward in relation to the femur. So in this case here, let's just use it where we're at. We have the tibia here, femur here. It's going to pull up and shear that tibia anterior or forward. And then as a result, what's going to happen here is the popliteus muscle in the back of the knee. If you feel like there's a bubble in the back of your knee, it's because that popliteus is actually contracting, or it's getting swollen basically because it's contracting so hard to prevent your knee from going more forward because the body wants to protect itself. Also, you'll see that people have tight hamstrings due to this as well, because the hamstrings are also trying to pull and force that back as well. So what we're going to be doing here is we're addressing a tibial nerve issue. And so if you were to basically flip the patient over, you'd go down from the glute area and work down the sciatic nerve distribution, and then it branches off and goes lateral, wraps around the knee, becomes the tibial nerve, and then that goes down kind of this anterior tibialis area, and then wraps around the ankle, and then goes into the foot and controls the foot being able to lift up and down like this. And so if you have tibial nerve entrapment, then that means that your foot basically has paralysis or foot drop, so then your foot can't lift up because this anterior tibialis muscle no longer works. So what we're going to be doing is going into the area where the tibial nerve is going to be coming around the fibula bone, which is this outer edge of the knee here. You can kind of see it right here. And what we want to do is we cannot go deep with this needle. We have to go right to where that junction is right here. We want to go slightly below where that nerve is. And we're going to go into it from this angle here. Let's go really shallow. Just like that. Let's do really shallow needling. Just like that. Okay. Any pain with that at all?
Mm-mm.
Okay. And then we're just going to go right into the anterior tibialis here. We're going to kind of pick the widest part here, which is going to be kind of this mid-belly area of the muscle. We're going to kind of pinch it up like this. And same thing, I don't want to go deep here. I'd like to go just kind of right in line with the skin, kind of like a fillet. It's obviously dinner time, so I can use food terms here. So we're going to pair these together when we hook them up to electricity. So next we're going to go through and we're going to do the knee joint itself between the femur and the tibia. And so we want to feel the patellar tendon right here. And it should be very soft when pushed upon if you're not in a contraction of the quad muscle. This one here feels literally like a rock. And so what's going to happen is that if the tendon is pulling to that intensity, it'll never let the popliteus muscle calm down. It'll always tell the quad that it's in a mini contraction, so to speak. So here it's very intense dry needling area. We're going to go basically through that tendon to help kind of loosen up and let it release, similar to what you do with the IT band. So we're going to go here, feel a lot of pressure and sharpness. Super intense. Right there. Okay. And we're going to go just below that too. So we're going to just basically put a puncture in the tendon itself, and then we're going to drive one just below that, and it's going to come up into the actual joint of the knee between the femur and the tibia here. And this one has a ton of pressure in it. It is freaking tight. That needle's just bending all over the place. Okay. Well, it's going to loosen up a little bit there for you. Doesn't feel like it right now, but okay. And then we're just going to go to the sides of here. So we're going to go kind of closer in so that we're still in part of the tendon, but mainly hitting kind of the meniscus area here. Just to kind of loosen it up from the whole entire aspect here. Perfect. And we're just going right kind of into the plateau right there of the tibia. So not super crazy depth on this. And then same thing, here's the knee joint here. We're just going to go to the inside of that where the tendon still is. Connect that right there. Go right in. From there, right into the plateau. Perfect. So not a ton of depth on these ones, and that's just fine. So last area that we're going to do here to work on tibial nerve entrapment is going to be the quads themselves. And it's very painful to do any kind of quad work in general on most people. So what we want to do is we want to find kind of right up the middle of the knee. We're going to go about 2 inches behind, because we have the patella, we have the suprapatellar bursa, or above the patella bursa, and then we have the fat pad as well. So we want to go right behind that so we don't lose any of the cushioning ability of the knee. We're just going to go straight into the quad tendon as it goes down and becomes patellar tendon. And this one just goes straight, like it's going like at an angle almost. Straight into that. This one here, there's no anatomy here that is in the way. And so I can go all the way down to the femur with that needle. Do you feel that go all the way down to the bone?
Yep.
Perfect.
It also felt great.
Me too. I think it felt great, actually. So I just know I hit it. So now we're gonna do. We don't want to do IT band too much. We're not worried about too much crazy stuff out here. You can actually see your rectus femoris, so you can't see mine. So mine's the size of a pea shooter. My vastus lateralis. Okay. Got a good femur there. Perfect. How you hanging in there?
It's okay.
Okay. So vastus lateralis, rectus femoris. Then we're going to do vastus medialis obliquus, and this is going to be that teardrop shaped muscle here. This one here, we don't want to go too low because that's going to be where our arteries and veins go. So we want to stay right up of those areas here. And that's typically going to be with any kind of knee issue. The VMO, or vastus medialis obliquus, is the muscle that needs to be overly developed to help with these issues. So now we're going to do up from here, kind of do that crossover between rectus femoris and vastus lateralis. Perfect. Okay. All right. Everything feel okay there for you?
Yep.
Perfect. All right, so we can see through here, we are mainly addressing the tibial nerve entrapment, which is going to come right through here, go down anterior tibialis right through there, and then we've got where the patellar tendon is right here, just kind of on both sides of it there, but also straight in the middle, as well as our quad muscles here. So we have VMO, or vastus medialis obliquus. We have the rectus femoris right through here, and then the vastus lateralis right through here. All right, so when it comes to these issues, I think the biggest thing is that we need to address primary, secondary, tertiary, so on and so forth issues. We've done this in this video where we said, okay, the issue of this knee is a tibial nerve entrapment, which is a branch that comes off of the sciatic nerve, goes right around the front of the knee on the outer side by the fibula and the tibia, the shin bones right in the lower leg. And as a result, the tibia, between the tibia and the fibula, there is the anterior tibialis muscle. And if this tibial nerve is being entrapped at the origin of the anterior tibialis muscle, then it's going to not let that nerve do its job, and the end result could end up being, in a worst case scenario, that their foot no longer has the ability to actually lift up because the tibial nerve is entrapped. Therefore, their foot has what's called foot drop, and then they basically have to drag their foot with them everywhere they go, right? And so some people out there, someone you may know, may have had a leg injury or a lower leg knee injury, and that was the result. And I've seen that too, where someone had a fluke injury and it resulted in their foot no longer being able to lift up, and they thought they were just done for, right? And one adjustment and one dry needling session in the same day, the patient never had to come back because it was gone, right? And so, a lot of times we got to look at, for one, their history. We got to look at, why it was there in the first place. What did they do as activities, right? And one of the things we talked about in this video and we kind of hinted at a little bit, but the patient here is a golfer. And so because it's the left leg and the patient is a right-hand golf player, they swing and they turn and rotate at that left knee, literally in the spot where the problem is. And so if you have a hyper rotation every time you do a golf swing, especially a driving swing, this could be the result. And so one of the biggest things is we said, okay, we have to actually train and strengthen the muscles that are going to be connecting from all of these different areas. And so we said, okay, we need less development of the quads or the front of the leg muscles. Those big, huge muscles that he had, they're so overdeveloped and so strong that it's actually inhibiting or hurting the other areas down the chain from there. And so we need there to be more of a focus on hamstring development or the back of the leg muscles to actually get the knee to actually strengthen again, right? We did notice too that the VMO had much more of a need for contraction when the dry needling was going. Therefore, we need to strengthen in the quad area the VMO or vastus medialis obliquus so that we can actually stabilize the knee, especially against that rotation of a golf swing that would then turn on the vastus lateralis muscle and then hyper develop that one, right? So then once we did that, and sorry, this is a bunch of stuff, we're just going over the pure anatomy here. So those who are anatomy buffs and can understand this, hope you guys enjoy. But the other part too is because when we have the two bones here, so femur here, tibia here coming together, where the quads become the patellar tendon, then hook in on the, so I think I did tibia over here, sorry. So the tibia on the tibial tuberosity, when that tendon gets pulled from the quads, it's gonna pull it vertical and superior or up, right? And so then it's gonna technically shear the tibia anterior. Therefore, when you have a bone that's going like this, what's going to happen is your system's going to be off. Your bend is going to be off in your knee, right? You're not going to be able to flex the knee, but then even your extension will be limited to some degree because your knee won't let you hyperextend because then what's over the top of here? Patella, right? And so, but if the patella is in the way, it needs to get out of the way, so quads are going to pull up patella as well, so then it's not going to grind, right? It'll still be painful, but it's not going to grind. So in the end result of that then is the popliteus muscle. So popliteus muscle is going to be a rotation based of the lower leg and ankle. And so one of the things that we did at the very end of this video is I said, okay, we have to hyper train, which that popliteus muscle, which means that we're going to take a band, right? We have an exercise band, and so we have the foot here. So this would be like where the big toe is, right, of his left foot. And so we take the band and we pull it here, and then he's going to go against resistance this way, right, to then strengthen the popliteus muscle. And so as a result, and how we put all this together for the patient is that we said, okay, when you do that motion, what's the result? And he said, ow, it hurts. I can feel it hurt in the area of the front of the knee, kind of between that fibula and the tibia. And so there's a direct correlation because it's pulling and it's actually forcing him to stretch or contract his anterior tibialis muscle. Therefore, the pain, the whole entire original pain is there. So we worked through the entire system of every single channel of muscle groups and how all the anatomy connects together. Then I said, if you can't do this one movement for your popliteus, because it basically brings you back to the whole chain, that's why we work it in this order, right? And so that's where a lot of people will go, well, let's strengthen the popliteus. No, it hurts. It hurts the tibial nerve and it pulls on it from the anterior tibialis. So let's release the anterior tibialis contraction to then release the quads like you saw in this video, right? We release the patellar tendon so that it decreases the tension of the quads as well, right? And then later on, right, we can go through and we can work and strip out popliteus if we need to, or the patient can do that at home because they've been instructed to do so and educated as to what the problem is. And so in the end, right, a lot of stuff, right? With this whole entire system of just one visit with this patient. That was just one visit that we did today, right? There's so much that can be said to help people. And like I said, we didn't talk about anything with the spine. right? So the answer is nothing to do with the spine in this case. We're working on an extremity issue, and that's why I'm an extremity specialist and why I work through these cases with these patients. Because yes, if it was something that came from the spine, easy peasy, no problem, right? But it's so much more than that, and there's so much that goes into it, and that's why I do what I do, and I love what I do, because everything I do is so different from other chiropractors. So in the end, I hope you guys enjoyed this video. I hope you learned something, and sorry it was a machine gun at the very end. It was just so much information. But if you really focus on anatomy and you love anatomy, then this is the video for you, or at least the end part of it is. But we're gonna just kind of cut it off right there, basically. So I'm gonna leave you how I leave you in every other video. We're at Supra Chiropractic. We've got your back and everything else. And we'll see you in the next video.